rights and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence. Motion to adopt the agenda is in order.
So moved. Support.
Motion by Birdie, support by Nicoven. Any discussion on the agenda? Would like to add under item 10A will be regarding attending a conference. And without objection, that was added.
Yeah, would you like a motion on the adjusted?
No, I think without objection is fine. All in favor signify by saying aye.
Aye.
Opposed? That motion is carried. The agenda is adopted. Next is hearing of the public. Is there anyone from the public that would like to address this body? If you do, you can stand at the lectern here. You have 5 minutes. Anyone from the public? Seeing and hearing none, we'll move on to item number 4, which is adoption of the minutes from our meeting dated August 23 of 2017. Motion to approve is in order.
Motion to approve the minutes.
Motion by Nicoven, supported by Flynn. Any discussion? All in favor signify by saying aye.
Aye.
Opposed? The minutes are approved. Next is item number 5, which is approval of standing committee meeting minutes and their recommendations.
I'd like to make a motion to approve 5A, B, C, and D because they have been previously discussed.
All right, motion by Flynn, support by Bush. Any questions or discussion, further discussion on these items? Seeing none, all in favor signify by saying aye.
Aye.
Opposed? That motion carries. Item number 6, A, is to approve contract with Aafia to extend report writing services and other SOL and crystal writing services to support Macomb County Community Mental Health IS team on an ongoing basis. And if somebody could
Yeah,
please, John, will you explain that, including all of the
Yeah, sure.
acronyms?
Thank you, Madam Chairperson. The statement of work is brought to you again as a continuation of that engagement that we have with Aafia. Last year, the board approved the original contract, which we have in the packet for your review, and it is related to information systems. We have information technology and information systems, and they're an expert and have the capacity to assist us with report writing and the logic that we ask and often need that go into, numerous reports of various types related to our electronic medical records, those that tie into PCE systems, that electronic medical record, and being able to draw down various reports of whatever sort and size we may need. And so they have a specialty in being able to assist us with expert report writing. The statement of work, I think the last one concluded in August of 16, and this is a continuation of statement of work for the upcoming year, and it's been reviewed by Corporation Counsel and asked for the board approval.
Thank you. A motion to approve is in order.
Move to approve.
support.
Motion by Brown, supported by Flynn. Any questions or discussion? Marilyn, did you?
No.
All right, all in favor signify by saying aye.
Aye.
Opposed? Motion carries. And I just went somewhere else and I gotta find can't find my. Shouldn't it be here? Oh. I'm going to stay here. Thank you. Next is item number 6B, which is the voucher listings through September 14.
Motion to approve the,
All right, we have a motion by Flynn to approve the payment of the bills.
Support.
Support by O'Connell. Any questions or comments about that? All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is item number 7A, employee retirement, Paul Militello. We need a motion to approve the
Move to approve.
motion by Brown, supported by Nagovan. All in favor signify by saying aye.
Aye.
Opposed? Motion carries. Next is a resolution for retirement for Virginia Musi.
So move.
Musi.
Let her retire.
Motion by Flynn, supported by Kraft. All in favor signify by saying aye.
Aye.
Opposed? All right, got to get used to not touching this thing unnecessarily. Next is item number 8, which is receive and file Michigan Department of Health and Human Services Office of Recovery-Oriented System of Care State Targeted Response Allocations. And who's,
Madam Chair, items 8A, B, and C were all reviewed at the Program and Budget Committee meeting. And if you'd like us to speak to them any further, we can. These are typically approved.
oh, all right, we already discussed those, improved those
Yeah.
before, at least accepted the reports.
Right.
All right. Then, do you want a motion to receive and file then? You don't have to. Okay,
This is just,
all right. Then item number 9, which is our management report. John?
And thank you, Madam Chairman. Well, first off, we'll look at our calendar, and then as I go through the management report, I would encourage, given the time, we have lots of time tonight, perhaps some extended dialogue relative to some of the issues that I'm going to bring up and how we can move our system forward as a board and administration. First on the scheduling, the first recipient rights advisory committee meeting is scheduled for October 5th at 7:30 in the morning at the CMH Administration Building. And then October 11th is Program and Budget Committee meeting here at 6 o'clock. And October 25th is the full regular board meeting here at 6 o'clock. We're going to talk later on, I guess, about the Michigan Association of Community Mental Health Board Fall Conference. Well, I'll just defer on that right now. Crossroads Open House. Crossroads Clubhouse is having an open house on October 6th. It's their 24th anniversary, and there's a chili dinner as well. The open house is from 2 to 7 o'clock p.m. Encourages the board and administration and the provider network and the community alike to participate if they're interested. The small fee, I think it's $7 for lunch or dinner. So that's October 6th from 2 to 7 p.m. And then tomorrow night, as a reminder, I think 10 of the 12 board members are signed up. Maybe one more can't make it. The Metro Region dinner meeting with Macomb and Wayne and Oakland counties. And that meeting is at the Metro Region, the Detroit Golf Club. And I believe you all have the time and address on how to get there. You've been there before. Any questions? Sure.
And
Do we have a committee meeting this Friday?
Oh.
Say that's it.
That's my next item.
Oh, just helping.
As prompted by
Mr.
the
Chair.
board. We can take a minute and talk about this too. As you know, the board has created a work group. It's a 2018 contract work group. And so there's been a select number of 5 members of the board that have participated in that work group. And there's 4 or 5 administrators that I've asked to also participate in the work group. We've had 2 meetings so far. We had an overview originally of our contracts, and without going into it with any depth tonight, there was an understanding that we have non-specialty services contracts, and I was able to articulate about 30 different contracts. The Aafia contract, by example, is a contract that's a non-specialty services contract. It's drafted by the partner, Aafia, and so it's not our typical language you would see in specialty services. Jackson Coker contract, that's the one that had the small print, Lou. So, Jackson Coker is another one of those contracts that we have numerous contracts with partners that are non-specialty services contracts. So what we were able to do in our first meeting is take that off the table. Those 30 contracts are not something that this committee is involved in. What the committee is involved in is being able to work collaboratively with the administration and also glean the interests of the board on how you would like and what you would like in the 2018 contract that takes effect on October 1st of 2018. So mental health sends out around 120 contracts, and substance abuse sends out around maybe 25, 28 contracts, if I'm not mistaken. So that's what the work group is looking at, is the content language of those contracts and how we're going to issue those in the future and what some of the interests of the board members may have in those contracts. So we went through that in the first meeting. The subsequent meeting, we talked a lot about procurement, and the work group was satisfied with our current procurement policy, and so there's no changes to that, and we can have a brief discussion about that this coming Friday morning at the work group, of which you're all going to be invited to, and I'll get to that in a second. So at the second meeting, we talked about procurement, and the work group had determined that our procurement process was well and good, and we need no changes there. There was considerable interest in our group homes, the conditions of our group homes, the management of our group homes, whether or not we do that ourselves or through another manager. I know there's some discussion too about retention of staff, direct care workers, payment of direct care workers. And so we have that on our plate as well to have some of that discussion. And then when we concluded at our second meeting, the board felt it was a good opportunity, the work group felt it was a good opportunity to bring the whole board together for an update. So you're being invited to the work group committee meeting at 8 o'clock on Friday morning, the 29th. The whole board is. And the meetings last just 1 hour. The board chair, Kathy, does a very good job at running those for an hour, and you're in and out. And at this particular meeting, Christina Ritz, the Director of Business Management, is going to present before us how she engages in the contracting process for community mental health. Then I would also encourage Randy to be participatory as well too, to be able to indicate how he does it for substance abuse. And so we'd like to bring the entire board up to speed relative to what that contracting process looks like. Then I think we should save a few minutes of time to discuss further work groups and how we can continually move the initiative along and be ready to begin writing that contract on or about the 1st of January. And then also with that, as you should know, I brought on, many of you know Pat Jens. Pat has been an attorney and a director here with us for many years, and I brought her back purposely. One of her purposes is to assist in the writing of the 2018 contract and get all the legal assurances in there to work collaboratively with Christina to make sure that contract is in place. As you know, Pat was instrumental in putting together the AFP, the application for participation in 2013. That was a 100-some page document that she worked on, and so you'll also see Pat Jens participatory as well. So if you have any questions, let me know. Yeah, sure, Marilyn?
Yeah, where is this meeting going to be held?
It'll be in the West Conference Room at the CMH Administration Building at 8 o'clock. And Christina and Randy will do a little bit of a presentation. Any questions in that regard? Moving on to direct care wage. Let's talk about direct care wages for a minute. One of the board members had asked that I pass out and circulate today. It's going to get a hard copy because I wasn't able to do it till late this morning. So I'm going to pass around an article that was in Crane's Business Magazine that spoke to the direct care wage issue. I think we, as an administration and a board, need to continue to pay attention to this and not lose our sights of what's going on here. The article that is here, it was actually an event that was over at Macomb-Oakland Regional Center. I was in the audience, and it was Macomb-Oakland Regional Center that held the forum, and they asked the House Cares Work Group to listen in on the concerns of the audience. Much of it centered around direct care wage increase. Some of it was around 298. And the third issue was related to staffing and monies and Medicaid dollars, privatization, that type of thing. So the discussion ensued with the consumers, and some providers were there as well too to talk about the direct care wages. The gentleman on the far right, when you take a look at that picture there, and the gentleman sitting at the table on the far right, his name is Mr. Vopel, and Mr. Vopel is a legislator in the House of Representatives. He's one of the co-chairs of the House Task Force. Well, he was interested in the direct care wages and interested in community mental health and prepaid inpatient health plans. He was particularly critical of prepaid inpatient health plans. So I think we have our work cut out for us over the course of the next few years to work with the House and the legislature on the preservation of the PIHPs, because that gentleman there, and I don't think he would deny his comments and what he had to say in the way of criticism toward the PIHPs. He's one of the co-chairs, of the House Cares Task Force. And I think that we need to talk about that at some point in time too. What it is that we want to do and how we want to work as a board to continue to emphasize before the legislature the importance of the PIHP and the public health system. So I'm going to stop for a minute. And Linda, did you want to ad lib further relative to your concerns in this article?
No, thanks for sharing it, John.
Okay.
The Citizens Advisory Council has been, this is on their agenda almost every month, the concerns. And the concerns about the group homes and the possibility of a waiting list and the quality of people that you can hire to care for their loved ones at this rate. Oh, I don't have my thing on. Did you hear me?
Yes.
Oh, sorry, Lou.
So
And there are members of the Citizens Advisory Council in the audience today, too, so that's good to see.
So I have a few extra copies of this particular Crane's article. If you'd like to have it, I'll leave it up here. I'll get it to the table after the meeting. You can take a look at it. So anyway, in conclusion, relative to direct care wages, as you know, the legislature approved the 50-cent wage increase for anybody that was a direct care worker. We did receive those monies in our budget that was recently received just last Friday. We're going through the analysis to determine how many dollars we actually received. I would suspect maybe we received 8% of about $53 million. And then we have to make sense of how we look at all those dollars that are delivered to us in particular service codes and determine how much money that we actually did receive in the way of monies to support direct care wage, and how we get that back out to the providers as well too. It's going to be, a pretty grueling task to make sure that all the providers get their fair share of wages to the direct care worker, and at that same point in time, they're able to identify the direct care workers, what their rate of pay was on September 30th, and then what their rate of pay will be on October 1st, and then report all of that back to us. And over the course of the next year, we have to eventually report that to the department, who will report that back to the legislature to ensure that indeed the direct care wage dollars did get to the workers. In the work effort between finance and business on our end is going to be incredible to be able to calculate the dollars and then reimburse the dollars to the providers. You just can't cut them a check. You can't cut them a check and say, here's your $900 or your $9,000. You have to do it in the way of service codes. So I won't go into it, but if we're paying $3.55 a unit for CLS, the providers may get $3.58 a unit, and some providers may get $3.61 a unit. That's the only way that you can appropriate the dollars, is when you bake it into the actual the codes that support the direct care cost. You can't give them a lump sum check of X number of dollars. Any questions? Brian?
Being the long process that you just described, about how long would this take before it gets implemented?
That's funny. Good question. We talked about that earlier. The CFO, Cindy Mack, and I did. It's the expectation that the providers would start paying that on the 1st of October. They don't have the revenue yet. And it may be, 90 days before we can get them the revenue.
And then the second question is, how do we know that the providers did go right to the direct workers?
Well, that's the attestation that's going to have to occur by the providers. And we're going to have to put that together. I think each PIHP and each CMHSP is going to be on their own, how they're going to be able to, ascertain that the fact that the monies did go to the direct care workers. But it is already known that the providers, all of the providers out there, let's say we have 65, 70 providers that are doing direct care work. Of those, there's 12, I said 17, there's 12 different service codes that we pay direct care workers for, like respite is a particular service code, community living supports is a service code, residential per diem, doing direct care work in a group home, there's certain codes for that. And so they're going to have to, anybody who we pay those codes to clearly has a direct care worker. And then they're going to have to give us the name. John Doe is making $930 on September 30th, and on October 1st, then he's going to make $1020. And then we're going to continually run audits to make sure that those monies that we give to those providers are actually going to the direct care worker and not into some other organizational line item on their budget. And then we report it back to to the state, and the state reports it to the legislature.
Thank you.
It's going to be difficult, but we'll get it done. And hopefully it'll have somewhat of a meaningful effect to our direct care workers, because, we need to do what we can to shore that up. The Metro Region dinner meeting that we're having tomorrow night, I think you should be aware the conversation. I don't have the agenda in front of me. The conversation, well, I do have it. I just need to be more organized here. It's on your agenda here. So we're going to have Bob Sheehan come in, if everybody find it. We're going to have Bob Sheehan come in after the welcome, and he and Alan Bolter are going to review Section 298 initiative and the pilot projects that are coming up. And so we can pay attention to that. I did put in this packet here, I believe, documents that I believe Bob Sheehan's going to pass out. So supporting the Michigan Association of Community Mental Health Boards, Bob has a strategy on how we work collaboratively with the Department of Health and Human Services to be instrumental in the design of some of the pilots. We have the Kent County pilot, and you may hear a little bit about that. And then, as I heard as an update yesterday, the department is going to let an RFI, so a request for information. So you'll hear Bob say it tomorrow, and you know how eloquent he is when he speaks. So he's going to tell you everything about the request for information, and it's particularly targeted at the community mental health services programs. It's not going to be an RFI that's sent to the HMOs. It's not going to be sent to the PIHPs. It's going to be sent to the CMHSPs. And then the CMHSPs are going to be able to, as he kind of describes it, raise their hand like maybe a little bit or a lot that they want in, or they're not certain they want to be in, to see what's it's going to include. And then those CMHSPs who show an interest in becoming one of those 3 pilots, then therefore once they're committed, the CMHSPs are going to have to develop a collaborative with all of the HMOs in their region. So if, by example, we said, okay, we're in, then through that pilot design, we would have to develop a collaborative with the 8 Medicaid health plans in Macomb County. And so I think maybe some community mental health services programs may want to participate, some may not. So that's the first round, how it's supposed to go, and make a determination through the RFI who wants to participate. And then I understand later on in the year or next year that they will let an RFP, and then everybody will be able to participate. Those who want to participate will be able to participate in the pilot programs, and then let them run for a couple years. The collaboration will be with the HMOs, and it's supposed to be designed toward integrated care. And for Macomb County, so you're aware when you're having this discussion, our interest is that we're already a demonstration. You heard me mention this before. Macomb County is already a demonstration. We're doing My Health Link. So it's a federal demonstration. And, you know, I don't think it's the best interest of Macomb County to also engage in a state demonstration when we're doing a federal demonstration. So some time ago, Tom Watkins, you know, from Wayne County, myself, from Macomb, the Brad Casemore, the CEO from the western side of the state, and Bill Slavin from the UP, the four of us, or the four of those regions, are demonstration regions for My Health Link. And we collectively put together a notice, sent it to Bob Sheehan, and said, because these four regions that I just spoke about are My Health Link regions doing a federal demonstration, that we should be excluded from being involved in a state demonstration for fear of contaminating or interfering with the integrity of the federal demonstration. And so that was our position. So you should know that tomorrow night, that it's my position, and we've already out there, and the Board Association understands that we who are My Health Link demonstration, we don't want to be part of the 298 process. So you have that knowledge when you go to the board meeting tomorrow night. You should also know, and not to be confused, that, you know, 6 months ago, that Metro Region did put in a pilot proposal. Matter of fact, we presented it down at the Detroit Golf Course, if I'm not mistaken. Maybe it was a year ago. But that proposal was a PIHP proposal, not a CMHSP proposal, but a PIHP proposal with Wayne and Oakland and Macomb counties. In that proposal, what we wanted to do is take the 500 most critical consumers that are out there, high needs consumers, those that are recidivating in and out of the hospital, not only on the behavioral health side, but also on the physical care side, and do the care coordination for those consumers. And we wanted to take the dollars, that proposal called for us to take the dollars from the HMOs and give it to us, and then we would use those dollars for care coordination, and we would do a better job than what the HMOs would do. So I just want everybody to be clear, should that one come up as well too. I don't think our proposal that we had sent in as a metro region is going to get any attention at all. I just don't think it will. I think the state has their mindset that they have a facilitator now that they've arranged with, independent facilitator, who's going to have them help write the RFI and see how many community mental health services programs want to engage in a pilot. I do know they want to do an urban demonstration, and so I just don't know who that would be. I think, you know, perhaps Oakland County, if they're not involved in anything, you know, Ottawa, maybe, you know, Saginaw Bay City. There's other urban areas that are out there, but that'll be up to them to decide whether they want to participate or not. I don't think we should. So Bob will be speaking about that on 298. Any questions on that? And then myself and Kathleen Kovac. Kathleen is the Deputy Director for Oakland County. Willie's in Hawaii. I told him to send me a postcard. And Dana Lansby. Dana is the Interim Director while they're going through the process of hiring a new director for Wayne County. So myself and Kathleen and Dana are going to talk about the House Cares Task Force in our tri-county perspectives. So I won't, you know, make you hear from myself twice. You know, I listened to, I originally met over in Oakland County, and I sat through the MORC House Cares Task Force there, and I described for that a little bit with you. I met with one of the co-chairs, Clint Kesko, over in Commerce Township for a short period of time, a week ago Friday or 2 weeks ago. I participated in the House Cares Task Force that was presented before the PIHP and the CMHSP directors yesterday morning, and I heard them speak again relative to some of the recommendations. I think the challenges that the House Cares Task Force will experience is there are so many different things that is being thrown at them, everything from jail diversion to the people that are mentally ill in the jail, to domestic abuse, to shelters, to Medicaid eligibility in prisons, substance abuse, opioids. I don't know how they make sense of it all. I just, you know, wouldn't know how they would be able to turn some of what they heard into legislation. They've heard so many different things. But anyway, the three of us will provide the the Tri-County Board with an update on our perspectives on the House Cares Task Force. There's one more task force coming forth. I think it's tomorrow, perhaps, in the CMH of Central Michigan region up in Harrison, and then they're going to conclude their activities. So should you have any questions, suggestions relative to how we can make the system of care any better, I'd be more than happy to pass those along to the co-chairs, Clint Kesko, and I think it's Bob Opel is the other gentleman's name. So that'll be the Metro Region dinner meeting. Any questions? And I'll be a little bit late, but you'll see me there. Before I have to speak, I'll be there. Been working with some of the House members relative to their interest in a community forum, and some of the advocate agencies as well that want Macomb County to have a community forum. And so we're looking at a substance use disorder forum sometime between October 30th and November 3rd. I think Randy and Helen are working on a date and a venue for that. I don't think it's been decided yet. And then, we have 11, 12 different grant projects. And so the scope of as I understand, the scope of the community forum, once we get it announced, date and time and location, will be to discuss the substance abuse issues that are going on in Macomb County, to discuss some of the opioid issues that are going on. We were offered up a CD to take a look at it by one of the House representatives for consideration, and we felt it was, on point but a little lengthy. And so Randy and his staff are looking for another appropriate CD that maybe we could show video, and then perhaps even some type of a panel discussion relative to what's going on in Macomb County, not only substance abuse treatment, but also substance abuse prevention as well. So you can see, and you will hear further notice, hopefully between October 30th and November 3rd of that conference. And then the staff are also going to walk through the majority of the grant projects that we have lined up for 2018, so they can make sense of them. So the community would have a better understanding of what our efforts are going to be relative to addressing some of the substance abuse issues in our county. I've also been asked to provide you with an update relative to the TBD Solutions. If you recall, TBD Solutions, they're the folks that were asked to engage in an analysis of Macomb County PIHP and our community living supports utilization management practices. And they came out, I think it was at the very end of August, and took a look. No, it was earlier than that. I can't recall. It was very end of the month, not August. They come out and they took a look at our community living supports utilization management practices. They went to Oakland County and looked at theirs. They went to Region 10 and looked at their practices, and also Mid-State, the Region number 5. And so they've have all of the on-site surveys that they've done, and it's stuck at this point in time. There's no further activity on it. I spoke with Tom Renwick last week, and Tom said that they are having difficulty. There's a number of data metrics that TBD Solutions already has as the vendor that's tied back to the support intensity scale. I've talked about this before, the SIS assessment. It's a pretty comprehensive assessment related to consumers with intellectual developmental disabilities. TBD Solutions already has all of that data, and it will tie in quite nicely the assessments, the functioning levels of our consumers with intellectual developmental disabilities in those 4 regions. And then they'll be able to use that along with their site surveys to look at the data on the SIS assessments, and then be able to draw some conclusions relative to, how we engage in CLS utilization management practices comparably to, the other 3 regions. So I'm being told by Tom Renwick that, it's being tied up right now based on the absence of being able to drill down and get that SIS data out of the system. Now, whether that's true or not, I'll take him for his word. But it seems to be prolonging itself and dragging itself out there. A couple of the House representatives are, kind of wanting to get this to move. They want to know the outcome of it. And Henry Ann is in particular, Henry, is saying to me that, before we can proceed to go after additional dollars, if we have the $10 million that the legislature was able to provide for us to shore up our ISF, that before we can go after the next $7.5 million, Henry wants to see how it has affected our community. And so I'll be calling on some of the staff and some of the community partners to be able to put a white paper together that I'll be able to show, or we should, through the board, show back to the legislature that here's how the drastic reduction in CLS services has affected our community, and give case examples and situational examples of how that's happened. And then that would be part of the merit for asking for the $7.5 million. Because there's still a suspicion out there that perhaps we're not needy of that additional $7.5 million. And, we have to be able to prove hardship, that it's actually, created hardship in our community. And so, maybe perhaps the findings by TBD Solutions in the department is that maybe we weren't so disparate in our practices as what we may have originally been perceived as being. And if that's the case, then that would be another reason why there's such a delay in the report coming out of the TBD Solutions. But the legislature's getting anxious for it. Jeff Yarich, he's also asking, where is it? Where's the report? When are we going to reconvene the group? I think Brian and Linda and a few others that went up, Kathy, that went up to the House when we presented out to the delegation, the House and Senate delegation back in March. So right now, there's no activity on that. Any questions? Yeah, sure.
I mean, the last meeting, that was part of the issue that I was asking to be done, is to see how it affects the community so we could take it back to the legislation. Have we started on putting some data together on that, how it affects the community, or we're still finding the time to do it?
Well, we need to get on it. I haven't done anything right now. Could I very quickly, by the end of next week, put a pretty comprehensive white paper together? Yeah, I can do that. We know how many units we've cut. That's not exactly what they're looking for, but we know how many units of services of CLS that we've cut in the last year since we've done this. Millions of units. So numerically, we can tell them that we know how many dollars that we've taken off the table that have provided those services to our consumers. So we can show metrics on units that we've cut. We can show metrics on dollars that we've cut. We can show the hardship that we put on our providers. And you've heard the providers speak about, with the absence of revenue, you take, $11, $12, $13 million off the table. There's a ripple effect there. The providers already have a hard time providing or finding direct care workers, because it's easy, if you have a consumer who needs CLS support for 10 hours, that get a full-time staff to go in there and provide somebody with that support. However, a lot of the consumers may only get 1 or 2 hours a day, and so try to find a direct care worker who's willing to drive to Armada for 2 hours a day and then go back home. The providers are struggling with that as well too, an unexpected consequence or outcome, but the providers are having a challenge with that. I have bounced an email that I received from one of the providers about the hardship of the consumers. I mentioned last time that, consumers have been put at risk. I openly said someone or a couple of them had died as a result, whether or not there's a cause and an effect, but I've subsequently wrapped back around to the provider and, being told that, 2 of our consumers who had no medical conditions whatsoever, long time living in the community with CLS support services, ended up going to a group home with no medical conditions, and 2 of them died. And they were in their 30s. So is it a cause and effect? Was it stress? Is it stress related that, all of a sudden, all these years I've been content and I had to move to a different group home and I died as a result of that? Our mortality review committee is eventually going to wrap back around and give me the skinny on that. But, it did happen. It happened with 2, healthy 30-year-olds. Some of them had contracted, sexually transmitted diseases. And there's probably a lot of other hardships that have been out there. Is that what the House and Legislature want? I mean, they want actual, vivid details of that nature. I can give them that too, because
I would believe so. I mean, just if it doesn't violate HIPAA laws, I would even see if we could tie names to them.
Yeah.
But, I mean, that shows our legislators, that shows that they're the constituents that live in their area, and this is how it's affecting their community that they represent. And a lot of those legislators, like they've been saying, what they're starting to change their mind is, I'm not on that board, I'm not in that department. But more and more, we've been talking, it doesn't matter if you're in that board, if you're in the mental health, or if you're in the finance committee or whatever else, this affects the people that you're representing in your community, and you need to find out about it. Mm-hmm. So the more we can show that these are their constituents and put a face to it, besides what the cuts have been, it is going to affect them.
So we can do that. We can do that in short order. Everybody has their own perspective. I have very limited time to be able to describe to you some of the inner workings of what's going on in administration. I don't want to put Christina on the spot, but if she's comfortable and the board's willing to listen to her for a minute at the microphone, you can hear from her perspective as well, because she's firsthand business director with the contractors and some of the challenges that they're having related to the absence of revenue, the absence of community living supports. The impact on the guardianships. I'm meeting with the judges here in the next couple of weeks. Lisa Lapina and I are going to meet with the judges that the guardians are saying, hey, we're not going to be guardian anymore because you've cut the services to the consumers. We feel we're at risk, even though the guardian doesn't hold responsibilities of day-to-day nature, that the guardians are saying, we're not doing this no more. We're getting out. So there's a number of bullet points I can put together in a white paper that I would share with the board, and then we can also share with the legislature, and at the same point in time, attach the need for the continuation of pursuit of the $7.5 million. Lou?
Okay, just Lou, then Linda, and then Susan.
If it's your opinion that a white paper approach is appropriate with Representative Yanitz and the other House and Senate people in the county, I think it's imperative that the white paper includes the ISF situation, particularly the shift from Healthy Michigan to our PIHP CMH side of the ledger, and how that number on paper is not a true figure that balances the ISF that is available to Macomb County. If you don't do that, John, then the State Department, in my opinion, does it to present a false status of what the financial situation is of PIHPs in the state to the legislature, and they are not equipped to understand the difference. They look at that bottom line, and what it says from the State Department is that financially things are good. But if things are not good, that's when the ISF becomes imperative, and you can't utilize the ISF from Healthy Michigan that's shifted over to the left side of the ledger. And they need to understand that. Otherwise, if they don't, they're going to be repelled when they try to get the additional money that we need. It'll work against us if we don't impact that, and I think we need to. The second thing that you were talking about on our losing consumers, in my personal opinion, and from the old days in another life, when I oversaw a 150-bed skilled nursing facility, the stress in situations of patients or consumers that changes radically can absolutely affect whether or not they survive certain situations. That stress situation is enormous. We have two physicians here who I'm sure deal with that all the time. I think that's critical to consumers who have been living independently, so to speak, and are abruptly, because of the change that we were forced to make by the State Department, has affected some lifespans. I don't think there's a doubt about that. That's my personal opinion, anyway.
Thank you. Linda?
John, thanks for the report on TBD. Because it does, if it were available, it would help reinforce our request for the $7 million. But my recollection of the $7 million was that we asked for 12.5, they gave us 5 with the idea that the way they could do it fastest and in agreement was that when the calendar page turned on October 1st, they would go into that budget year and at least entertain and have conversations about the rest. The calendar changes on Sunday. So I'm not, whatever day, I have to look. But, so I'm not comfortable with kind of just waiting for TBD. That was to show Renwick and Linda Zeller and the rest that we indeed, you know, were comparable to other counties and so forth, and not out of line, and shouldn't have been punished with that actuarial study to the point of $30 million. So I'm not comfortable with waiting for TBD. I'm not comfortable for kind of waiting to see how it plays out. I don't know, but I don't know where they're busy, so they're not thinking the calendar page turns on us on Sunday, but I am. So I would like to see, and I would like to hear what the other board members think, that that's the direction we go, that we, I understand Henry wants to know impact, but the money that we get is only, to me, is only going to replace this, this place, it's a place setting. Moving that Healthy Michigan 5 million over is only a placeholder. So so we need to be restored with that and get that money back to where it is. It's just my opinion, and I hope other board members will speak on what their take on it is.
Thank you. Susan?
Thank you, Madam Chair. Yeah, I mean, I echo Linda's comments and Lou's too. I mean, the placeholder of the money is really just, it's just paper. I mean, it's just, it's not really, it's not restoring services. It's not shoring up our books. It's not, I mean, it makes it look good. It makes it look balanced, but it's not doing what we are here to do, which is provide service to consumers. I mean, I'm distraught by that. And even when these numbers come back from TBD, if I'm saying the initials right, you know, I'm going to want to look at them really close and say, is it sound what they're saying? You know, what those numbers, I mean, numbers can be, you know, masterfully managed. Just like the books, like, you know, just like what we're seeing with our funding reserve. So, you know, that money appears to be there, but it's really not. It can't be spent for what it's in reserve for. So that's a little trick. The other thing, as far as the white paper, I mean, I can appreciate the value of a white paper, but it's only good if somebody reads it, and it's got to really speak to the human factor of what we're dealing with here. I mean, the stats, when you give a stat and say we cut this many CLS hours, that doesn't talk about the person that can no longer live independently. I mean, you know, the heartache of that, and having the consumers, you know, speak to this board and talk about the hardships of it, that's what needs to be in the report. I mean, to Brian's point, this has got to be, they have to see that it is hitting their constituency. And even if they don't live in their particular district, it's hurting people that are very vulnerable. So I you know, the stats are all well and good, but to me, pitch them at a high level and then just say, now what does this mean? And then shine a spotlight to the degree that we can without violating HIPAA. But and if people are willing to come forward and speak their story, I think they should be there with us. So, thank you.
I have another speaker. Joan, did you want to address anything before Joan speaks?
You know, you have no argument with me. I agree with Lou, relative to the Healthy Michigan dollars, Healthy Michigan Plan dollars that are sitting in there in the Medicaid state plan and B3 as a placeholder, because you can't use them. I agree with that. And there's, $6.3 million in there. That's just the fuzzy math. I agree with Linda that, it wasn't my intent to hold this up. I've had some discussion with the board chair and understand, and we'll certainly get this moving, that, now is the time to strike as the board, or as the legislature reconvenes, and to be able to address this. And I agree with you, Linda, as well, or Susan as well, too, that to the extent that we can put, faces or at least clinical profiles together that says, without the breach of confidentiality, here's what one of those cases or a few of those cases look like in the way of hardship. I can do that as well, too. And then I think it will be critically important that, we as an administration and a board send out a notice to our constituents, and to the extent that we urge them that they've been cut services, that they go to the coffee hours here locally and tell their story. There isn't any better way to do it than tell your own story, as many of the consumers are advising us, and they're taking the microphone and they're telling us their stories. And those who are able to go to Lansing and speak before, their legislator as well, too. I think we're really going to need to push that. I think that there's a number of very vocal and good advocates who are parents, who have had, severe cuts in services, and we need to really motivate them to reach out to the legislators and tell their story at the same time that the letter and request for the $7.5 million goes out, along with the white paper too. And I'll get that moving, and we can talk about time specifics. We're here, coming in October. You want to clear our plate of that by November 1st, I can do that by November 1st. You want to do it sooner than that, you tell me the timeline, and I can hit the mark. It won't take too much time, but it should be choreographed to some extent, where we're, put the white paper together, the letter, and then also send out a corresponding letter to many of those people who have been cut and say, now is the time, this is the window period to go see your legislature to help reinforce the fact that we need the other $7.5 million. So we'll put a timeline, we'll get it done.
Good. Joan?
Thank you, Madam Chair. You said something about Chris. She could explain something. Can we have that?
I put Christina on the spot. Christina, are you comfortable tonight, or would you prefer to wait maybe until Friday to, maybe talk about some of the hardship that providers are having from your vantage point? What's your prerogative?
I don't mind speaking to the hardship a little bit tonight, but I'd rather just give contract and stuff for Friday.
Okay. Why don't you come on up and give it?
Well, John mentioned it. It's the only reason I brought it up.
I can speak to the experiences business management has since the hardship. I think that there's a couple different dynamics. We have the change in the CLS hours, so that creates stress on the providers because they're used to providing a certain level of care. That level of care has changed. They may or may not be supported by the coordinator case manager with regards to help with the individual and help with the person-centered plan. That plan might need to change. Thank you. So, and it's not a matter of the provider wanting more cash flow. It's not a matter of them going, our staff aren't making as much. They can't support the staff. They can't sustain that many staff to continue to provide service to that number of people, because the number of people they're serving is not changing. The hours are changing. One of the really difficult points that I talked about at a provider meeting last week is their authorization might be as low as 1.5 or 1.7 or hours a day, or 45 minutes a day. You're not going to find any staff that's willing to do that, and if you do, they're going to quit very quickly. So they're constantly restaffing. They're constantly working with the families to find somebody new. That's a big stress on the provider, on their staff. Their morale is down. So, one problem just kind of creates a domino effect throughout the system. We have providers that are saying, I don't know if I can be a provider anymore, because it's impacting on both ends. And I want to make it very clear, it's not a matter of them wanting more revenue. They want to just sustain. They are passionate about serving those in Macomb County. They want to stay here. They've been here for years and years. They don't want to leave those that they've cared for 15 years, 20 years, 2 years. They don't want to leave them behind. And they're faced with that, because they can't sustain the staffing. They can't pay the staff a competitive wage. They can't attract them. So their turnover is increased. So we're seeing things like that happen on the residential side. We're seeing that happen on the CLS side. And we're seeing that happen on the skill building side. That's another big one that we can hopefully talk about next month. But it's really been a snowball effect. And my division's getting phone calls, multiple phone calls daily with all the struggles that they're having. Did you have?
Through the chair. So is this going to go in the white paper? And who's going to read this white paper? We've tried before white paper. Nobody reads it.
Well, I think the Macomb House and Senate delegation, given all of the attention that we've brought to this issue, will take time to read it.
I agree with you. I think the consumer should go up to Lansing. I mean, I see it on TV where they're storming Washington in wheelchairs. Well, why don't some of our people get up there? That's what we should organize, something like that, not a white paper. Have they been up there?
Thank you, Kristen.
Yeah,
Thanks, Kristen.
Thank you.
I had a couple questions from Susan and then Linda.
Yeah, I'm sorry, Christina. So my question is for you. So I agree that we should add this. I agree with Joan that we should add the business model stress that this is causing, because many of the people in the legislature are business people, and they understand. I mean, obviously they are also compassionate people, so they have empathy for the problems that the consumers are facing and the family members, but I think they're also business people and they understand the model. So one question that flew through my mind as we were talking about the 50 cents an hour is, I defer to my friend over there who does all the books, but if you give somebody 50 cents an hour a raise and the legislature expects you to actually pass 50 cents an hour to the employee, then the company has their share of money that they have to pay in taxes and workers' comp, and if they are fortunate enough to have a 401k or anything like that. I mean, that has a ripple effect in a cost model to a business owner. So what ends up happening is in theory, maybe, in a 50-cent raise, maybe if you're lucky, 35 or 40 cents would actually reach the employee, right? But
Correct.
We're being told we have to give the whole 50, our providers have to give the whole 50 cents. So what happens in their business model to cover their costs of that? Have we done any of the math on that?
We have not started looking into that, but I mean, that's a great perspective. And one thing that happens is the staff here, I'm going to get this 50-cent raise, and then they don't get a 50-cent raise, and then they leave the position. So, they're almost set up for failure at that point because, they are being given additional dollars, but there is that whole pass-through, and it's not going to go to the staff as they might think it's going to go to.
Right, so I think number one, we need to paint that accurate picture and understand what the requirement is. If we are gonna have to provide a ledger that says, here is a list of all the employees, here's what they were making, and now they're making 50 cents an hour more. If it's not 50 cents an hour, we're gonna have to demonstrate why it's not and what happened to that. And by the way, how much of that went to the state too, by the way, because, you know, some of that's gonna be state taxes and, you know, I mean, and justify some of this. I mean, I feel like there's almost like a, you know, multi-phased approach that needs to happen in this documentation with some live presentation, and I'm more than happy to present if that's helpful. So, thank
And we
you.
have a great rapport with the providers. We have some that are really coming to the table and trying to problem solve, you know, things of the similar nature with us. You know, they will break down their costs for us. They will show us every penny, where it goes, how they're doing that, because we've been looking at rates for the past 5 months, and you know, some of them are really partnering and supporting us through that transition and showing us where the needs are.
Thank you.
Just before I have a couple more people that want to make a comment, but if Mike Sessa were alive today, he would be screaming about unfunded mandates, so.
Yep.
Coming down to us from Lansing. I have Linda and then Brian. And someone else have their mic. Can you turn your mic off a minute, Joan, please, while I talk? That's why we're getting that feedback. And so you want to be on the speakers? You want to speak as well? Okay, well, we'll have John explain that in a minute. And just as a reminder, the questions really need to be directed at John, and then if he, as appropriate, he can ask staff members. So I have Linda and then Brian.
Well, I just don't want to leave this topic without saying to John and Cindy that you did what any board would be glad to have you do. You sharpened your pencils and you got rid of all that red ink. So I do appreciate the effort and all of that. I just want us to go back to the legislature. And for the conversation about the consumers and their families and the representatives going to Lansing, two things. They've done that on 298. They've been they're in the audience. They could tell you they you know, give of their personal time and work time and everything to do that. And the 7.5, none of it's going to restore services. So we just need to point that out, that we're talking more than 7.5 to restore services and to pay vendors appropriately. And so we need a lot of meetings, Joan.
Brian?
Thank you, Chair. John, I think that's a good point about the providers. I think we should have a twofold onto it. One, how it affects the consumers, and also how it affects the providers in their area and how it's affecting their business and how it's trending down and hurting them. I mean, we present it separately, but we present it on the same day to have a good discussion on it, explain it well, explain the second half of the providers, and then in an aspect that it comes out to being like that, we would reach out to bring consumers into a second meeting, I would suggest to do with the legislators, not the hearing board, not the appellate board or nothing else, but actually sit down with the representatives that are out of the county and have a meeting in Lansing, wherever they could set it up at, and let them hear directly from the consumers that live in the area. Yeah, they can do it at the town hall, but I mean, there's an effect to that situation too, to get them together. Says, this is what we talked about. Here's the consumers, and invite the providers to come talk too, and do it right in Lansing. Because when Linda talked about the 298, it was done in a room and you got 5 minutes to explain to it, and it went on to the next subject, and you're going to the appropriation hearing to hear what it is. It don't sink into the legislators that are not on that appropriation hearing. There's staffs in there, but it don't sink in. And I mean, I'm willing to even put something together with the legislators on that, because I've been talking to quite a few of them, not even just in Macomb, but in Detroit and Oakland County.
Anything else? on your
A few
report?
more things, if it's permissible. You know, the white paper, I can, you know, I understand that people don't want to read long documents, but there's a mountain of information I can put in those, in a white paper. You know, they'll show the hardship. You know, we can't lose sight of the fact that we continue to cut services to consumers. in each one of their personal stories, as many personal stories as we can get out there, but the providers as well too. You have a very committed provider panel here that provides direct care services, and we have not been able to provide them with more competitive rates. And so, we're coming into 2018. Before I know, it'll be 2019. It goes that fast anymore. We need to be able to do something to reinforce a rate that's competitive and not the 2015 rate that we currently have, Matt. So, there'll be a number of things that we certainly can add into the white paper. And then if it's all right with the chair, Cindy Conal always wants the microphone, and I've never given her the opportunity to have the microphone. So, putting you on the spot, did you want to make any comment relative to it from where you're at? Cindy is the director of access and engagement. She's the front line of where all the consumers call in, and her staff and what she's hearing within the Medicaid fair hearings too. When we meet with the Medicaid administrative law judge, Cindy's staff goes in and meets with the Medicaid fair hearing folks and opposes the consumers. You want to comment?
If you could turn your microphone on, just push that button down in front.
Okay. There's two sides to it. So we've been told by the state that we have overutilized CLS hours. Access follows the level of care, which has been determined by our Utilization Management Committee. So the Utilization Management Committee looks at the level of care and says, okay, this is how many hours that you should be getting for CLS. Some really hard decisions have to be made, and they have to be made all along. So at this point, 66% of our budget is going to support services. These are non-mandated services. These are services that we offer in support to a consumer. 33% go to the actual core services. Those are our professional services that we provide, that we're mandated to provide, hospitalization, doctor services, those kind of things. So we really need to look at what, as an organization, you guys think that we need to be focusing on. There's no going back and forth at this point to the way I can see it, and this is just my opinion. We have been cut those dollars. We have to figure out where those dollars come from. We have to make a decision as to why are we here, what do we want to do? And we've, I think, made some of the decisions already because of the level of care and because of what we're attempting to do in access. But that's what's so important, is to be looking at the whole picture, to be looking at what the state has told us. Are we an outlier? And I know, I'm a social worker, and I think, okay, we really need to be providing these services for people. We have done it all along. We are causing a huge hardship at this point because we have to pull back because we don't have the money. And we need to continue to look at, okay, should we continue going down that road? Should we continue to provide 24/7 support services for as many people as we have, or should we be pulling back on that? These are all decisions that are being worked on. They're through our level of care, and then access follows that level of care that's determined at utilization management. They make the business practices, They make the business practices, and then it's access that follows those business practices, that follow that guideline. And then we also look at each case on an individual basis to say, okay, this is a person that this is where they fall in that level of care. However, because of extenuating circumstances, they may need more. They may need more services. So it's a very difficult situation for the access managers to continue to operate on a daily basis by looking at these, by going to the Medicaid fair hearings. I can't tell you the number of staff that have come away in tears saying, what do? We're social workers at heart. We want to be able to offer this to people. But we also need to look at our plans. We have to look at what does independence mean? Does independence really mean living in the community in a small apartment by yourself getting 24/7 services? I mean, is that independence for everybody? So to begin to look at, okay, what does this mean for each individual person? Thanks.
Thank you. Cindy.
Okay.
All right, so we'll talk more about the contracting on Friday. Hope everybody can make it from 8 to 9. Then I'm about done with my report here. I'm just now getting acclimated to my attachments. The first time I've done it. So I spoke about the Metro Region meeting, the proposed strategic plan development 2018. That's Bob Sheehan, and Bob's going to go through that tomorrow night with you guys. I think he'll give you this as something very comparable relative to the pilots. The next is a news release, immediate release for notice of a AOT, assisted outpatient treatment. It ties into Kevin's law. And so we submitted a grant to the Flynn Foundation, and we were awarded $25,000 for that. So that's going to go into place beginning of October. And so we're pleased with that. And then also particularly pleased as well with the notification that we received from the department a couple days ago that Macomb County Community Mental Health has received acceptance from University of Michigan Department of Psychiatry and Michigan Department of Health and Human Services to participate in child-parent psychotherapy learning collaborative. So it's not being offered to too many community mental health services programs, just a few. I think the department understands how well we do children's services and how organized our children's services division is. And they reached out to us to ask us if we wanted to be participatory in this collaborative. And so it's an evidence-based practice called CPP, Child Parent Psychotherapy. It'll take a year for them to work with us relative to onboarding. And so we understand the clinical dynamics and how you actually engage in providing CPP. And then it'll be an added collaborative, or an added, not collaborative, but an added continuation of our services for children, and this is going to particularly address children up to age 6. So we're really pleased by that as well too. One of just a few CMHs that are actually going to be engaged in this collaborative. And while I have it on my mind, we also should know, those who are going to the Michigan Association of Community Mental Health Board Fall Conference, that one of our staff is presenting on current day trafficking, the trauma of current day human trafficking. So if you want to listen in on that presentation, that'll be presented on the first day of the conference, early in the morning. And the last thing I wanted to indicate to you, two things, I'll make them real short, is, we've been under a cloud for quite a long time, and not only has the board realized that, and the administration and the providers and the stakeholders and the consumers, but we've plowed through the majority of our financial situation. We still have more work to do in 2018, but we also need to start taking effort and opportunity when we can do so to have a little more pride in our agency than what we do show to the community, and also to be a little bit more boastful too. And that's why I'm going to continue to work with the marketing folks, because we do provide an awful lot of good quality services to consumers. That's not what is getting attention of the board. So I've really encouraged my staff recently to believe in themselves, to believe in Macomb County Community Mental Health. If we weren't doing it right, we wouldn't get a contract. And we've been contracted with the board for 50 years. And if we weren't doing it right, we wouldn't get a PIHP contract. And we got another PIHP contract. So we're doing it right. Let's continue to refine our system of care. We got a couple years before I think, the monies may move. And I think that we all need to start taking opportunity to show pride in what we do have in Macomb County Community Mental Health, and not to turn our back on the concerns or the problems, and to be a little bit more boastful about them too. Oakland County, Wayne County, they're particularly boastful on what they do. We should be that way as well too, and I'm going to try to lead that charge. And then the last thing I'll mention is on October 11th, we present our budget to the Board of Commissioners. And so we've already done all of the front-end work on that. It sounds like they're going to fund us for the general fund dollars, just some supplemental dollars that have helped us out with our crisis center, about $230-some thousand in local dollars, county dollars. And then also too, they took off jail diversion. We wanted funding for jail diversion, and they took that off. And then they're going to just give us a small amount of money to support our GF operations as well too. So we may come away with about $500,000 from the Board of Commissioners. At that time, I'm also going to present to them some of the strategic planning that I've been doing. And I just want to let the board know, because I'm going to present it to them on October 11th at 3 o'clock, and I'm going to bring it to this board at 6 o'clock. So I don't want you to feel slighted that I tipped my hat on what I'm doing to the Board of Commissioners before I tip my hat to you. I have showed my abbreviated strategic plan to the board chair. And so that's the strategy for the next couple of weeks. And if you ever have any questions, certainly give me a call. I'll be able to fill you in more so. Thank you.
Okay, thank you. Lou, do you still have your question?
I don't have a question, I have a comment. Is that still okay? I just wanted to comment on the fact that listening to Linda and to Cindy, I was really so saddened, because what I was thinking of at the time that both of them were making their comments was the state act under which we're organized gives us a primary responsibility. And that primary responsibility is clearly elocuted in the act. What we're supposed to do is we're supposed to assist every single consumer that we treat, to assist them to be elevated at the highest level that they can safely maintain in their life, that provides safety to the society in which they enact. Clearly, that's a challenge that the State Act requires that we meet. And what saddens me is this $36.5 million cut out of nowhere under what I consider irresponsible dialogue on CLS has changed that situation dramatically. And frankly, I think it's a violation of state law, if you want to push my personal opinion, but it's the saddest damn thing I've ever seen in my life. And frankly, I think it's irresponsible on the state's part. And I am kind of tired of being gentle about it. I think we ought to damn well tell them that they're way out of line and they're in violation of the State Act under which we've been formulated to act. And I think that unless we make these comments strongly, I doubt if things are going to change any too soon for the people that we treat. And it's the saddest time in my life, and I've been at this a long time, and I think we have a responsibility through white papers and through action directly to tell the state that in our humble opinion, they're in violation of the State Act. And I don't think that's a minor situation. I think it's a strong position that, frankly, ought to be in the white paper for openers, John, if you'd care to weave that language in, because I think, frankly, the state has put us in a position of violating that act through no choice of our own, and it just made me sad, and I just wanted to say something about it. I'm sorry, but I think we need to do it.
Thank you, well stated. All right, you are complete, finished? Thank you. One question.
John, for the October 11th meeting, would you want some of the board members to show up to that meeting?
For the Board of Commissioners?
Yes.
No. No disrespect. No, much of the legwork has been done through, because we submit our budget to the county executive, and the county executive has met with us once already relative to our requests. And really, it's not so much the Medicaid, because it's the state recognizes the Medicaid component of it, and the state general fund dollars as well. It's the ask that we have of the county for the drawdown and the match, and those are both about $1.9 million. So comparatively, our budget is really small to the Board of Commissioners, and we're just asking for required match and drawdown dollars. So I don't, if you want to attend and show face, that's great, but I don't suspect that we're going to have any challenge in being able to get our budget approved through the Board of Commissioners. I think it'll go pretty smoothly.
So then it's all right just to show up and not speak.
And you can speak too.
Well, okay. All right. I just want to make sure you're
No,
right with that.
I appreciate your support. If you're welcome to attend. It's at 3:00 is when we're presenting on October 11th. You're certainly welcome to attend. I don't think we'll have any difficulty getting the budget through the BOC.
Yeah, it's nice to look at the board.
Okay. But it's a public meeting. Anyone may attend that wants to, so. Then that brings us on to item number 10A that we added, and that's approving for the board and staff to attend the October 22 through 24 conference. Motion by Bush, supported by Flynn. I'm sorry, motion by Doherty. I heard it over there. Any discussion on that? This will be to approve those who are attending, and if you haven't already made reservations, speak with Barbara. All in favor signify by saying aye.
Aye.
Opposed? All right, then continuing on other agenda items, one of the things that this board, in conjunction with our director, we need to decide what we want to do with these meeting recordings. There's an audio recording and a video recording. We don't need to decide tonight. That'd be something, they're there. We can decide what we want to do with them. Just have them available. Should they be FOIA'd? Do we want them to go to some digital place in the sky that the public can access? So just be thinking about that, and we'll have a further discussion of that next month.
Are you saying that this is recorded both visually and audio?
Yes. But what you see on this picture right here, on that little pad that says memo or MIMO, whatever that is, that's what the public would be seeing.
Well, I think we ought to show the recording on Saturday nights in charge admission.
There we go.
You gotta dye your hair first.
All right, so I just wanted to bring that up. Be thinking about it.
I didn't know that. I mean, so it surprised me. Okay.
The Board of Commissioners, and they've been doing it even before we had the system, we would record them. They all go to the Board of Commissioners there's a link from the Board of Commissioners website where you can click on it, you can read the minutes, and you can also view the actual meeting. And now with this system, you can look at the minutes, and if you want to hear what the discussion was, you can click on that part, and it will bring you to that part of the video where they held the discussion on those items. So, anything else from any other commissioners? Seeing none, we'll go on to item number 11, which is hearing of the public. Is there anyone from the public that would like to address this body? Please come up to the podium, and if you could push that button down on that black half circle. Identify yourself, please, and
my name is Tony Plua. You may have remembered me from about 3 meetings ago. You all elected me as one of your Citizen Advisory Council members. I had a warm welcome that day. I still feel warm about it up until this moment. First of all, I want to thank Lou. I support you, and I got about 100 families behind that would love your comments on the illegality of what has taken place, or your viewpoint on that. And I also have something to add to that, which may be a pressure point item. It touches on something Linda Bush said a few minutes ago. John has mentioned it, CLS reductions and all that folds into something that I'm about to say. I want to call your attention to a meeting that this board has had 90 days ago today, where Nick Cimitero brought to your attention, it was the last item on his speech. He called the attention of the United States District Court, Eastern District of the Southern Michigan, that it was illegal. In effect, it took 25 pages to say these following words. You can't put somebody in a more restrictive environment. That's against the United States law. The name of that law is called the Olmstead Law. John's very familiar with that Olmstead Law. I know many of you others may or may not be familiar with that, but it requires the least restrictive environment to be supported by, funded by the state. There is a place where we're becoming vulnerable, and Linda mentioned that there are about 30 people on a waiting list for a group home. We also found out through some of the very fine information we've gotten from John through our CAC meetings, and by the way, that's a compliment. I've learned tremendous amounts there. Of the 30 people that are waiting for group homes, somewhere between 15 and 20 came out of the denial of CLS. Now stop and think about what just happened here. You've got people waiting for group homes because CLS was denied, and the law, the United States government law, says you can't put people into more restrictive environments than they're in. So you're opening yourself up to lawsuits, is my point. And I'm here to tell you, I don't want this board to be blindsided, but even though we might know that as a truth, it's against the law, there are at least a dozen families that I know of right now that also know that that's against the law. And they would consider litigation. Now, I don't know whether litigation is something you want to put on your plate to help propel you do this faster, but I, for one, can't believe how long it's taking for me to get hours for my own son. But this is not about my son, it's about dozens of others. I'm saying that right today, you're vulnerable. That if you took somebody out of CLS service and puts them into something that's more restrictive, it's against the law. Now, if you want to do nothing with that, that's your choice. If you want to do something with that, that might be a line item in that plate of work that you got, John. Anyway, that's the end. Any questions?
Thank you for your comments, Mr. Plow. If anyone has questions, I'll ask you later. One of our rules is we don't respond during this portion for time purposes. Thank you.
Did I go up over 5 minutes?
You did not. You still have another minute if you want to keep talking. All right, thank you very much. Is there anyone else?
Yes. Okay. And I want my husband to come up too, because he's not going to get out from doing. Come on up here, hon. We're here. My name is Carolyn Gamicia, and I'm actually a CAC member as well. I've been on the CAC, I think, since 2014, and I proudly volunteer my time to serve on that committee. I've learned a lot, and I do think that it's a valuable asset to the function of Macomb County Community Mental Health as well. And I want to just give you a quick frame of reference for why I'm here and why we're here tonight. I had a sibling, my brother grew up, and at 12 years old he was diagnosed with epilepsy. His life ended in Walter Reuther Hospital due to misdiagnosis and not being diagnosed with a medical condition that he was restrained within that facility in 1999, and he died from a pulmonary embolism from being restrained. We currently have a 26-year-old son with autism that has been receiving services in Macomb County since we moved here specifically from Wayne County and the city of Detroit to obtain better services. My husband and I at that time were both police officers. We had to quit our jobs because there was residency, and we came here to Macomb because we knew our son with autism would get better services. That was in 1994, I believe. At that time, I came before a board meeting just like this, and I said at that time that you needed to really address services because you need to also support the families that have significantly challenged children, because otherwise you'd be also serving the parents within your mental health consumer agency. At that point, our son was given a children's waiver, children's Medicaid waiver, and I will say that the good waiver that's turned into is because of our blood, sweat, and tears. We developed it to be a model waiver for the state, and we've actually shared how wonderful it is across the country with the success from our son and how he's utilized it for many years. Our son would not be where he is now without the children's Medicaid waiver support that we obtained until the age of 18 for him. He was diagnosed initially with significant autism, very significant, self-injurious, injurious to us, injurious to his sibling, very challenging behavior, nonverbal, and a young child that could not even form a bond with us as his parents and his family. It was very, very difficult for us to obtain services for him then. And we also advocated for you to develop the respite home in Macomb County. I was on the board initially to choose the provider, or the committee to choose the provider for that facility when it first opened. So we've been involved for many, many years. Our son transitioned to the HAB waiver program, where he now is receiving services. And I'm here tonight because we've advocated and helped families for the last 16 months to ensure that their loved ones are not placed at risk, are not put into a system of care where their quality of lives are lessened. I do not want to see, because I testified to close state institutions after what happened to my brother. I testified to close Mount Pleasant at the state legislative hearing to do that because of my brother's death and the death of many, many people in state facilities. What I'm seeing and hearing now is we are headed back toward institutionalization in this state. We have been a state that for many years has lauded self-determination and choice, many, many years. We've done that successfully with Medicaid dollars. Our son's life and has been enhanced. Our son was able to go to Macomb Community College and get an associate's degree with the support that he received from his waiver. We just got a notification recently that our son's services would be cut by almost 50%. And I'm not going to go into that because right now we're still in the process of trying to work it out. We have an appeal hearing scheduled for an administrative tribunal. And the thing about it is, though, I'm here because not of our son. I'm here because of the many other families. I'm here because of Tony's son. I know Ron Plewa. I know what Tony's family has invested into his son's life for the last over 10 years to keep him interdependent in the community, which every single human breathing person is. We are all interdependent on each other. So when I hear someone say that a person, is it independence to have 24-hour support to live in the community? We're not asking for independence. What we're asking for is a quality of life that is humane, does not put people at risk so that you can save 50 cents to $1, or that does not include sacrificing choice, self-determination, the quality of life, and the benefits that we receive as having people with disabilities in our community. every single day. And I can tell you, everyone that's been a provider for our son loves him. They still continue to have a communication with him, even as a provider for him as a child. And I'm saying this today because I'm worried. I'm worried that people on HAB waivers that have gotten their services cut, and the HAB waiver is a level of care and support that would be, if it wasn't available, the person would be in an ICF facility. That's an institutional facility. That's a group home where they don't have choice. That is a group home where they cannot choose who they're living with. They cannot choose what they do on a daily basis. They cannot even choose the food that they eat. So the reason that I'm here today is because I want you to realize every time you cut a CLS hour from somebody's HAB waiver, you are risking them having a HAB waiver. You are not saying that that person does not have that intense needs set anymore. That's what you are risking, and that's a violation of Medicaid. And that is a civil rights violation for every single person. That's the 30 people waiting on a waiting list to get in a group home. That's the 15 to 20 that are there because of CLS hour cuts. And I will tell you, it's more than that. It's Ron Pliwa not being able to go out now because his hours have been cut, having to go home on weekends, and a person with autism does not understand, will I go back to my own apartment? Or will I have to stay with my parents, who, I don't know if you look at Tony, he's kicking at in his 70s, but you know what? We can't take care of our kids the rest of our lives. And that is the thing we think about every day. No matter how functioning, what level of functioning our children are at, that is what we think about every single day. Where will our children be when we're gone? Where will they be subjected to abuse or neglect? Will the person that cares for them make less money than at McDonald's and even read their individual plan of service? This is your legacy, yours. Each one of your board members, everyone that works for Macomb County CMH, this is your legacy. This isn't a threat. This is reality, because we're violating civil rights of people with disabilities here. And I'm not going to bend on my knee because I don't have to beg. I do not have to beg for services for my child, because I'll do what's needed to make sure he does not lose his interdependence in the life that he loves, that he worked so hard for. And he will not die the way my brother died, in a facility that did not provide him proper medical attention, that called me in the morning and said, your brother has passed away. And I said, why? He's 44 years old. He's healthy as an ox. And they told me he had a heart attack. So I asked for a police investigation. The police officer called me, and within 24 hours, he said, I'm really sorry to say there was no doctor on staff when your brother died. And I'm going to tell you, that's the first time I've ever been to that facility, because usually people don't care about the people in that facility.
Ms.
If you care, I'm done. If you care, I want you to really think about what's transpiring. I really want you, and that's why we came today. It's not only about our son, it's about every single person that's getting services and support from Macomb County CMH, because I do not want to have our legacy that we worked hard, that a lot of people here have worked hard, that the Pliwas have worked hard to hang a feather in your cap on, because we are one of the best service providers in this state. We are. So I'm sorry, but I'm emotional about this, because our son is leading a very happy life because of the supports he gets from Macomb County CMH, and I want to thank you all for that. But I want you now to realize the risk management that's involved here is beyond what's going to be in a white paper. It's about people. So thank you very much.
Thank you for your comments. Is there anyone else that would like to address this body?
You thought you all get away from me, because they came, right?
No, I saw you wiggling back there.
My body was moving, I was ready to come up
Yep, that's what's happened. Mr. Birdie, thank you for your words. Lisa Lapine, Arca Macomb. I don't have to speak about the individual issues for consumers because there were family members here who did a fantastic job, and I'll just follow up with the same, which is you also got the home and community-based waiver coming down your throat, so moving folks into more restrictive settings isn't going to get you anywhere with the feds. That being said, I want to talk a little bit more about the provider issues because I think Christina did a great job, but I want to tell you I'm really excited about 50 cents. Okay, I'll figure out how to pay the taxes. I'll figure out how to do what I need to do to make it happen. I'm a little scared because I heard a rumor that I might have to cover it until it comes through. I can't do it. There's no money there. There is nothing there to cover that 50-cent mandate if I don't have that coming through. So we're gonna have to figure out what the penalty on that is, what the problem with that is, and I'm gonna have to figure out how to make my union folks in my shop happy because they're not gonna get their 50 cents if I have to do it without that pass-through. I don't have it. The other challenges that providers have, this per diem structure that you guys have right now is killing us. Maybe you can work for 3 hours, maybe you can work for 5 hours, but if an individual works for 5 hours, they're now earning less than minimum wage based on the payment structure that CMH has set up for the 3 to 5 hour range. It doesn't get okay to get up to about 16 hours a day. And guess what? Nobody's getting 16 hours a day. So when it comes to these per diem schedules, these per diem rates, and you guys are learning about those, if you need any kind of information from a practical standpoint, I got a really great memo from my CFO that explains it to me in very elemental language. He's the CFO for a reason. I'm the CEO for a reason. He explained to me in really, really simple terms why we're not making it. So the per diem rate's an issue for the providers. It's a huge issue. Voc rates are a completely difficult issue for the vocational providers right now. There are vocational providers who will be giving notice that they cannot provide services anymore. And guess what? That means your CLS providers are going to be stressed out because we aren't going to be taking people to work because we can't serve them, because we can't afford to. So when we close our doors to the voc services, your CLS is going to have to go up, right? Because you've been banking on that to provide 5.5 hours of support a day in addition to what they're getting for CLS. So if I close my doors because I can't do voc services, what's going to happen to your CLS rate then? I personally called Mr. Renwick and talked to him a little bit about this whole CLS issue, and I'm a little confused because he does have trouble with one number, one code number, but there are 3 CLS code numbers, and we don't use them here very effectively. Why aren't we using the other 3 codes effectively? And what could we do to maybe partner with him to use those codes more effectively so we don't have to worry about these money dollars so much? Other issues for the providers? Your recipient rights department is going to put some of us out of business. We have to send our folks to training and we have to pay for that, and there's no compensation structure for that. And every time there's an investigation opened, and I am, quite frankly, very happy to partner with your rights office when it makes sense and it's appropriate, but then they have to have us send them back to training. I got to pay for them to go back through training and back through training again and back through training again. You don't pay me for that. I have to figure out how to pay for that. And the thing is, I can't find enough employees to work that when I have to send them to training, I got a 2-tier problem. I got to pay for them to go to training, and I got to pay for someone to cover their shift, and I can't even find people to cover the shift so they can go to the training. And I spend more time on recipient rights complaints and recipients' rights issues that take over 120 days to complete than I have done in 20 years of services. And the outcomes aren't any better. Trainings. I got to send all my folks to trainings. And every training that they have to go to, I have to pay for. You don't pay me to send them to training, but I got to send them if they want to go past meds, if they want to be able to do, I have this new one where I have to do this threat management. We all have to go to threat management training. Guess what? My threat management is, stop it! But if I have to go to threat management training and I have to send 20 people to threat management training, I don't have those 20 people to work.
30 seconds.
Oh, we're broke. Financially, we can't take one more cut. CLS cuts, voc cuts, transportation cuts. We haven't had an increase in forever. Providers are dying. Staff people are choosing to go to self-determination because they can get a higher rate. And now the per diem structure is even challenging that ability to provide services in that arrangement.
We got to find a fix. We're willing to partner. We'll help in any way. Thank you.
Thank you. Anyone else?
I'm Larry Dideki, live in Sterling Heights. Do you need the address? You got it.
No, that's good.
Okay. Bear with me here. I got a little bit of PTSD, so I get going real fast, you'll understand. I'm going to carry on with the rest of them sit here. Our son is 44 with Ron, and they're in an apartment setting, and it's very independent for him. Now, with these so-called cuts, and you've heard it 1,000 times, but I got to express my opinion. He comes home on weekends, and not to say he's a bear, it'd be an awful lot. He's scared. He does not want to come out of his apartment. He's been there for 11 years. And he keeps telling me, I don't want to come back. I want to come back home, you know. And I guess when I'm saying the same thing everybody else said here, I don't know what type of power you can do with these politicians, but something's got to be done. Thank you.
Thank you. Anyone else? Seeing none, motion to adjourn is in order. Motion by Flynn, supported by Kraft. All in favor? Aye. This meeting is adjourned. Thank you, everyone.